The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. Tonight we're going to take a look at what is probably the most ominous issue that we can deal with here in the Bronx and frankly all across the world, and that's the Omicron variant that has taken us all and sent us all for a loop because it's like, wow, I thought we were past this, and now all of a sudden we have something that's even more contagious, more infectious, although happily doesn't appear to be as dangerous. We have three excellent experts with us, all from different aspects of life in the healthcare world, and we're going to give you a chance to hear what they have to say about what's going on with the Omicron variant. But before we start, I wanted to just put some things in context. People, let's say, well, wait a minute, where did this thing come from? How did it happen? So if you take a look, we've got a graph that will show you. Look at how quickly this came upon us. I mean, essentially all the way through September, October, November, December, you can see on the far right, there were just kind of little notes that maybe there's something else. Then by December 11th, 8% of the infections were COVID infections were for Omicron. And then it grew, and look all the way. It got to 70 between December 18th and Christmas Day. It got up to 77% of the infections. And now Omicron is basically taken over the COVID infections. Not to say that Delta's not out there and there are not other issues. We'll ask our healthcare professionals to talk about that. So that's just, you can see that this really is something. It's not like something that the media or somebody else just made up. The other thing I want to show you, because we always want to put the Bronx in context, let's just look at infections in the city of New York so you can see what neighborhoods they're in. Obviously, the darker numbers are the more infected zip codes. And goodness gracious, I mean, how many times do we have to look at maps like that, whether it be for economy or housing issues, and we see our home borough of the Bronx has the worst of it, and it appears right now. Let's take a look at the Bronx close up. You can see maybe your own neighborhood, the West Bronx particularly hard hit, North Central Bronx hard hit, and every time I read a different local newspaper, they flag a different zip code in the Bronx as saying, "Oh, this is the worst one." I think the bottom line for all of us is to do all the things you're about to hear from our guests, to keep yourself as safe and your friends and family and neighbors as well. So let's introduce our guests. I'm thrilled that we have the First Deputy Commissioner and Chief Equity Officer of the city's Department of Health. Welcome to Dr. Torian Easterling. Nice to have you again, sir.
Thank you, Gary. Thank you for the invitation.
The Assembly member in the 87th Assembly District, a member of the Assembly's Health Committee. She's also a registered nurse. How handy that is for us in this particular circumstance. It is Assembly member Karines Reyes. Nice to have you with us, Assembly member.
Good to be here with you, Gary.
And the Assistant Vice President of Medical, Regulatory, and External Affairs, a COVID expert for one of the most unique and fabulous local health organizations anywhere, certainly in the Bronx, Urban Health Plan, Dr. Viju Jacob. Dr. Jacob, nice to have you with us, sir.
Thank you so much, Gary. It's a pleasure.
Dr. Easterling, let's start with you. Where are we at? I mean, I showed some numbers. There's a million numbers out there. How is the city doing? How is the Bronx doing as regards fighting COVID and the Omicron variant?
Really good question. Thank you again for the invitation. Great to be joined by this esteemed panel. I think the top line is that what we've been hearing for the past several weeks, we are certainly in another surge. We are seeing a high number of cases citywide, as the map has shown. And so what we can say is that this is widespread community transmission. Specifically in the city, we're seeing over 27,000 cases over a 7-day average. We haven't seen, the test positivity this high, primarily because of the presence of the Omicron variant, because it is more transmissible. But also, we are doing more tests per capita than anywhere in the world. And so that just really speaks about how widespread the variant is moving. In the Bronx, we're seeing about 3,500 cases per 100,000. Really high transmission when you think about CDC's categorization around transmission. So this just really underscores how important it is that we do all the things that we know can really keep people safe and protect lives.
We hear, and the numbers show, and in fact, the Times had a map recently of hospitals and what ICU capacity is like. It appears there's still 80% filled in the Bronx hospitals, which shows that if we were in this situation way back in the March 2020 or April 2020, we would not be in as I don't want to say as good a situation, but we would not have even any space in the hospitals. How are the hospitals doing? Are they near capacity? And then we're certainly going to get to the assembly member about staffing and nurses and things like that. But just start in general about capacity for hospitals to deal with these issues, especially in the Bronx. Montefiore, St. Barnabas, Lincoln, you know who they are.
Yeah, absolutely. We're in a different moment. That's the reality. We're certainly in a different moment because we have a high vaccination rate. But the reality is that we are seeing increases in our hospitalization rates across the city, not just one system. And so we are monitoring our healthcare system very closely. Right now, what we can say is that our hospitals are able to handle the patient load currently. But we're going to have to really track this closely. One, because we know that the staffing, that's really important to take care of the patients who are coming in, they themselves are turning out to be positive. And so we're seeing staffing shortages. This is why the mayor announced yesterday the plans for the city to really support our healthcare systems, not only H&H, but also our independent safety net hospitals, because we need to continue with an equity approach and really take care of the neighborhoods that have been hardest hit. And also, we also know that the Omicron variant, as we already know, I've already mentioned, more transmissible. So even though we are seeing milder infections, the sheer numbers of people who are turning out to be positive, even if there's a small percentage that are unvaccinated or have underlying conditions, can put a strain on our healthcare system.
The mayor said, and this is a new mayor, so I don't know how much that has, I hate to put it this way, trickled down to the hardcore healthcare workers through the DOH. The mayor said he wants to keep the city open. Can we do that safely? I mean, then we have to talk about schools as well. Can we keep the city open and learn to live with COVID? Is there enough protection out there? Or is this still the kind of thing we're going to have to, shut down something somewhere? I mean, how do you view that? Dr. Easterling, that's for you.
Yeah, I think it's a really good question. I do think that we're going to have to learn how to live with COVID, and then we're doing that. You see how resilient the city is. We're in our fourth surge. We know what to do. We know how to take care of ourselves and our community. We have vaccines. We have a really high vaccination rate. We have the most robust testing infrastructure. And as I've already mentioned, we're doing more tests per capita than anywhere in the world. And New Yorkers know all the other things, testing, masking, making sure that we're doing distancing can keep us safe. But it's going to be really important that we continue to message this, as well as all the things that we do to keep our schools safe.
I do want to bring our other guests in, but let's face it, we've all seen the huge lines for testing. So on one hand, I can appreciate that you say we're doing more of it. On the other hand, whether it's not sufficient or it's not distributed properly, I just heard about some vans in my area in the Bronx that have been put out, I'm assuming by the city, that do not have long lines, yet we still see every day we see video of people standing, and I know somebody who waited for 2 hours in Co-op City just to get tested. So where are we at shortening those lines?
Well, we're continuing to expand our testing infrastructure. I think you've heard not only the mayor, but our executive director of test and trace, and kudos to our colleagues at T2, the work they have done even before the holidays to really expand our testing infrastructure. We now have over 200 sites in New York City. That includes our mobile vans as well as our pop-ups and our brick and mortar sites. In addition, we've been doing a lot to really expand our distribution of at-home test kits, which we know are really important in really fighting back on the spread of this disease. And so it is about access, and we're going to continue to do more. We're not going to stop where we are. The other thing that I know is really important is really making sure that we can shorten the turnaround time. And H&H has really done a lot. Many of our results are coming back 24 to 48 hours to make sure that individuals know that they get their results, and then they can do the things that they need to do once they find out that they are positive, which we know is to isolate. And so these are the things that we're continuing to monitor, and we're going to continue to do that.
Assemblymember Reyes, how are you doing over there? Let's see, Parkchester, Castle Hill, Van Ness. That's your spot. Just give us firsthand impression of how your constituents are doing.
I think what we've been seeing in the district is similar to what we've been seeing all over the Bronx and all over the city, that it's been difficult to get tested. We have very long lines, particularly in the Parkchester sites. We see them every day. We recently had a new H&H site open up, which is providing some much needed relief to the other sites in the area. I think that there was a period when not just the city, but I think the state run test sites were kind of contracted, and the focus was on vaccinations. And now when we have such a large swath of the population that's vaccinated and this new Omicron variant, people just want to get tested. We had to scale up rather quickly. And the city has been doing a very good job at that. We thank them for bringing a new site. We've been in communications with them regularly, suggesting new sites in the area where we see really a disparity or a lack or a greater need. And that's an ongoing effort.
I like the idea of the vans because you can put them around, you can move them to places where you think you really need them. And so that's my editorial comment about that. Talk to me, if you would, Assembly member, about staffing. I know that you were concerned about nurses, but of course, all health professionals are, they're closer to anybody than to people who are infected. And of course, staffing at hospitals and of course in schools is down because of the, they're all getting infected as well. Talk to me about your concerns, and are there solutions, and where are we at in terms of keeping things running from your perspective?
Yeah, so we have multiple problems. First is a significant number of breakthrough infections amongst healthcare workers, which of course it has been kind of thinning the staffing pool. But the reality is that we had a staffing shortage way before the pandemic ever existed or ever even crossed our minds. And that was something that we had always been fighting for through the nurses union. We had legislation to have safe nurse to patient ratios because we knew we needed more staff. And then during the pandemic, we saw a lot of nurses who were of retirement age who just left the field altogether because they were older, because they had underlying health conditions, just a lot of folks who just never returned to the medical field. And we're starting to feel the impact of that, particularly now with all the breakthrough infections. And we, hospitals have an opportunity. They had an opportunity prior to this to really ramp up their staffing and look for ways to attract more talent, particularly in the Bronx. I know this is an issue that the governor is focused on. She mentioned it in her State of the State address, where she will be putting funding or offering free tuition to those that would want to go into the nursing field, that want to pursue a career in medicine, and making it easier for people nurses who hold licenses from other states to have reciprocity and be able to practice here in New York. And those are all barriers that we have to remove, but we also need the kind of like the will of the medical facilities to really start hiring and training and staffing up.
Right, and make that commitment. Now, I know you've got a couple of bills that you'd like to see, monies for millions of dollars for school-based health facilities, and also to and we're going to talk about this in a moment with Dr. Jacob, with cultural competency and understanding the differences between people and what their ideas are. Just talk to me about what you'd like to see come out of Albany from your perspective.
Yeah, I think, look, if we want to talk about health disparities amongst people of color, we have to talk about cultural competency and how they are interacting and receiving health care. So that means that we have to train our medical professionals to understand the nuances and differences amongst people of color and different cultures, because that usually impacts outcomes. And we see that in maternal mortality. We see that when it comes to pain management, overall outcomes, because there is a lack of competency amongst healthcare providers. But another thing that we've been working on, and this is a budgetary ask, is we want the state of New York to submit a state plan amendment to CMS, because we have an opportunity to expand school-based health system and school-based health programs. Actually, in 2012, there was a rule change in CMS, and other states took advantage of it, and they're able to bill Medicaid for school-based health services, and New York hasn't been doing that. And what the pandemic has shown us is that we really have to expand healthcare services in schools, right where children are. There's going to be mental health disparities that we're going to have to address amongst our school-age population. And we have an opportunity to leverage state dollars and get those matching dollars from the federal government if we submit a state plan amendment. So I'm carrying a budget letter this year, and I would love to see the Department of Health take this on seriously and see that money flow into our state schools.
Well, let's get down to where the rubber meets the road, and that is with Dr. Jacob. Urban Health Plan serves 90,000 clients a year, and the large majority of those are in our home borough of the Bronx. Are people getting vaccinated? Do they take this seriously? What do you see from your perspective, sir?
Yeah, I think, the Bronx has always been, the most difficult borough when it gets to a lot of resources. In our population, we've been lucky that we've been able to push out vaccines from very early on with the support from both the city and the state. We were able to become one of the, prime vaccination locations. We thought that over the holidays prior to Omicron, there may be a little bit of a lull, and there was a little bit of a lull, but our line, we now have lines again in front of our vaccination locations for people coming in for their boosters. We're seeing a lot more children, luckily, coming in the 5 to 11 year age group. The last time we looked for our adult population, we were well over 85% of our population had been vaccinated in the primary series. So we're focusing a lot on the booster doses right now. I'm so happy to hear the Assembly members' support for school-based health centers. As a pediatrician, that is a huge resource for our community. Urban Health Plan runs 12 school-based health centers, and I serve in a school-based health center. So, it is an opportunity for families to come get our care. We've been trying to vaccinate out of our school-based health centers to get to the younger age groups, because it's very difficult. As a kid who grew up in the Bronx, it was very difficult for my parents to take time off to get me into my regular care, and having the school-based health center is a primary.
Yeah, it's a way of saying to a family, you're not going to get it done, because if you send the child home and say, go to a health facility, somebody's taking off a day of work, it's just not happening. I want to talk about the vaccines now. If we look at the vaccinations all across the city, The numbers, for the Bronx, we're kind of in the middle there, although pretty much matched up with Staten Island and Brooklyn. You can see that. But if you look at this is what I think is interesting, and maybe all three of you can weigh in on this. If you look at Bronx vaccinations, we have the breakdown. There it is. We have the breakdown of ethnicities. Asians in the Bronx, 83%, Hispanics, 67%, white people, 63%, but Black people, 58%. And I'm going to offer my own theory on this. There's so much distrust, and this goes into what Assemblymember Reyes was saying. There's so much historical distrust and we've talked about disparities in healthcare since the beginning of this program 27 years ago, that people, it appears, African Americans are saying, you know what? I still don't trust this. So Dr. Jacob, we'll start with you. Do you see people still saying this despite the overwhelming evidence that they do help? They keep you may not get infected, but you will do better, it appears, if you are vaccinated.
Most definitely. As I do community presentations, I quite frequently get the question from the African American patients who are sort of just very they have their sort of concerns. They don't want to be experimented on. That's the wording I hear quite frequently. And it's not just the community. We have among our own associates, we have a lot of pushback from our African American associates who sort of are, they're like, they don't want to be first in line for this. They want others to go first and make sure it's safe. So it's definitely a concern. Do
you find that you're able to kind of turn them around and get them to kind of agree, okay, I'll do it. It seems to make sense.
In many cases, yes, especially if we can have, I actually had one of my colleagues who is of African-American descent join me on many of these presentations to sort of hear from someone who represents them, who looks like them, because I feel that bond helps to sort of overcome some of the concerns that they may have getting the messaging.
Dr. Easterling, do you have a sense, are the numbers just abundantly clear that the people who are hospitalized and not doing well with Omicron or any aspect of COVID are the people who are unvaccinated? I mean, is it abundantly clear from a scientific point of view?
Absolutely. Gary, it is a really good point. What we see in our data, our weekly rates, when we look at cases, hospitalizations, and deaths, those who are unvaccinated make up the majority for those indicators. And so the science and the data really points to how important vaccines are effective and really making sure that they are protecting individuals against severe illness and death due to COVID-19. But to this point around building confidence, we know that there's no one silver bullet. It's been about access, and not just about brick and mortar sites, but also about language access and making sure that individuals feel represented when they're showing up at these sites. But we've had to use incentives. We've had to use other policies such as requirements. It's really been about, making sure that we're using all of our messaging tools, all of our interventions to really ensure that individuals know that these vaccines are effective, that the sites are available to everyone in their neighborhoods, and really encouraging them as well in understanding how important these vaccines are.
Assembly member, you're in the profession. Do you, and I've heard this and I've seen this, you find even with colleagues who are close to people who are infected, who are still hesitant about getting the vaccines? I'm hesitant to hear your answer. I don't want to hear it.
Absolutely, but we've had mandates that now require all healthcare workers to be vaccinated, and that was kind of part of what thinned the herd a little bit in terms of the number of healthcare workers were those people who dug in their heels and refused to vaccinate. Even professionals who understand the science, who understand how vaccines work, have seen the deaths that this pandemic has left in its wake. We're just not trusting of the science of getting the vaccine. Wow. And that is what's really troubling. And we see that in the numbers you showed us.
I hate to say I don't agree with it, but I understand it. For many years, you feel like you are living in a separate society. So when society says this is what we ought to do, they don't go with it. Dr. Easterling, how accurate are, because we hear people say, well, I got a positive test here, I got a negative test here, I'm not really sure what I have. How reliable are the tests that are going out? Are home tests as accurate as what you might get in one of the vans? Dr. Easterling, if you could just weigh in on that, we'd appreciate that.
Yeah, certainly. So we know that our PCR tests, so these are molecular tests that people are going to our brick and mortar and our mobile sites to get tested, where those tests are sent over to labs and then they're ran and analyzed, and you're getting your results in 24 to 48 hours. We know those tests are much more reliable, certainly, than the rapid antigen tests. And these are also antigen tests that are used sort of at home, that you can get your results in 15 minutes. We're hearing that the sensitivity of these tests are not always accurate. So you can certainly end up with false negatives for these tests. So that's why it's really important, to follow the instructions as we have been distributing at-home test kits, really making sure that individuals know that there are 2 tests per kit for a reason. You want to take it on day 1 and follow that test on day 5, really to ensure the accuracy of that test and what is reported.
That makes a lot of sense. Dr. Jacob, I have a friend who posted on her Facebook page, I'm sick, but I'm here alone. What do I do? In other words, she didn't feel like she could go out and stand in the cold and wait to get a test. I'm sure you have patients who contact Urban Health Plan. What's your advice?
We've been using our telehealth resources for patients in exactly the situation where, they're unable to come out, they're too sick. So they call into our practice. We have an entire clinical call center team that is dedicated just to responding to patients that require telehealth services, whether it's over the telephone or virtual. We've been lucky to partner with the health department and now this week with the federal government, and able to get some at-home test kits. So we've been able to give it out to our associates as well as to patients in the community. So I think as Dr. Easterling said, the PCR is the gold standard, but any test is better than no test, especially if you're unsure and you want to sort of keep your family safe, you want to keep your community safe.
I think we're running out of time. I think the bottom line for what you said is reach out, don't suffer alone. There are, I'm sure if you call 311 and ask for information, I'm taking Dr. Easterling's point for myself, that they will refer you and help you figure out how to navigate it. Assemblymember Reyes, going back to Albany and keep fighting for the things you talked about, right? Got about 30 seconds.
That's right. We were up in Albany for the State of the State last week. And we're ready for a budget season to keep fighting for resources for our community and our state, and to pass major pieces of legislation like we did last year, this year, that are going to influence the people of New York.
Dr. Easterling, the last word from you. Get vaccinated, get tested when necessary, follow the rules and mandates. Did I just steal your thunder?
I couldn't say it any better.
Great. Listen, we had 3 great guests, and we're going to keep talking about all these issues. Dr. Torian Easterling, Dr. Viju Jacob, and Assemblymember Karines Reyes. Thank you all for joining us. I'm going to say the same thing. Get vaccinated, stay safe, wear your mask, social distance, be conscious of it, and let's do one thing. See you next week for more Bronx Talk. Good night.